Underrated and sure, like.
You guys played them well for those two quarters. Huge weapon.
Yeah,
Right?
but if you look at the pipeline, you're like, what are you doing? What? And again, I didn't mind that we lost Ohio State. I don't mind that we lost the week.
Yeah, that was kind of figured out.
Um,
Yeah, because you guys were doing really well.
Right. So this would be saying. But let's see. I'm just not a fan, haven't been.
You went to, did you go to?
I did not actually, because no, I went to Central Washington. My sister went to University of Washington, because we're a year apart. And we were together. So I went to every Husky, there's 100 miles doorstep to doorstep, so she went to every game. And I went to every. We go back and forth.
Your whole family's Huskies, right?
Yeah, I was born.
Like police officer.
You asked, like, I was just born into
That was in
that.
there. Yeah.
But,
Did you go to
Sure.
University of Oregon?
Yeah, and my whole family did.
Like, oh, see,
Yeah, I've been going to games since I was 12.
know.
Yeah.
It's strange.
Uh,
Yeah, I definitely know, I don't need it.
Yeah. Yeah, it's like been alone.
My sister did.
Hey, everybody, I think I'm gonna call the meeting to order. It is noon and we have a lot of ground covered today. Even though our agenda is pretty brief, we want to make sure that Holly and her team have enough time to talk about the local plan, which is hopefully you guys have had a chance to at least take a look at it. So the meeting's called to order and I'm gonna go around and do some quick introductions. Going to skip the one interesting thing for today's meeting so we can kind of speed through this a little bit. So Holly, would you like to start?
Sure. Hi, everyone. Holly Harris, Health Services Director.
Oh, Laura, like, presented visitor.
Former board member.
Board members, nice to have you here. Amber Clegg, recovering behavioral health director. And Shannon's going solo now. It's going back to my clinical manager role of Access.
I'm Melinda Thomas, Chair of BHAB, and I'm an attorney with High Desert Education Service District.
Carrie McKenna, Cameron asked me to come and participate.
Great, thanks for coming again.
Shannon Brister August, interim behavioral health director. I'm not sure why, but. So
She abandoned you.
you abandoned me.
Michael Schultz, Sheriff's Office. I operate the jails.
Holly Will Starling, Senior Behavioral Health Director at St. Charles House.
And newest board member.
Yeah.
Welcome.
Evan Namkung, Forensic and Acute Services Program Manager.
And online, somebody help me read who we got. Lee, why don't you go?
Hi, Lee Butler, co-chair, a drug and alcohol counselor at Redmond Treatment Center.
Linda?
Linda Nolte, adult foster home provider for IDD.
Okay, I can't read. I can't see that far. Can you help me out?
Yeah, Mary?
Hi, everyone. Mary Burns with the Central Oregon Health Council.
Nicole?
Hi, Nicole Keith. I'm Crisis Program Manager with Deschutes County.
Wait, did Linda go? Linda?
I've already introduced
Oh,
myself.
sorry, I was reading something
Next
about
to
that.
Nicole.
Stephanie?
Hi, Stephanie Haroon. I'm a board member.
And then Susan.
Hi, sorry, didn't know we were gonna do introductions. I am a behavior professional and I'm just kind of sitting in trying to figure out what this meeting's all about.
Welcome. Thank you, everybody.
If you think it could be serious, ask me to call emergency services.
Susan, what is your last name?
My last name is Savant.
Savant, okay, Savant.
Yep,
Awesome, thank you so much, and thanks for joining us.
sure.
Okay, do I have everybody? No,
All right, Kristen, Rocky, program manager.
and of course Dana.
I guess.
All right, did I get everybody, miss anybody? All right, so I'm going to ask for a vote to approve the September minutes, which Dana included in her email that she sent out earlier this week. Do we have any questions or a motion on the? Anyone want to offer a motion? Did somebody move to approve the September board meeting minutes?
Motion
This
to
is
approve.
Stephanie. I'll move. Oh, sorry, Lee. Go
That's all
ahead.
right.
Stephanie.
Well, then I'll second it.
Stephanie's moved to approve. Anybody have a second?
Second.
All right, all in favor, say aye. Aye.
Aye.
Any opposed? All right, the motion is approved. And so we're gonna move straight into the director's report. Holly, you've got the floor.
Thank you. Yeah, just a couple of quick updates. Behavioral health director, so my position that I was in, it is currently posted externally, so closes December 4th. And so we're trying to kind of move along and get through that because we have a lot to tackle this coming fiscal year. So we are really hoping to get a candidate in place by the first of the year if possible, but we will see how that goes. You know how our best laid plans are. So that's all in process. Just got back from the Association of Oregon Counties Conference this morning, drove in from Eugene, and a little depressing, I'll be honest. There's not a lot of good news happening right now. So it's pretty tough news. Just federally, state budget forecast did come in higher than expected. So that's good, but it's still a pretty significant shortfall. So we're still not looking at any major wins. The short section is going to be starting here soon. I don't think we're expecting to try to accomplish too much in that. It's going to be fast and furious, and I think anything we're trying to do is going to take more time. So we'll just kind of keep an eye on that. We're going to spend most of the day on the local plan. So hopefully all of you had a chance to at least skim through it. I know it's a riveting document. I mean, I apologize. There's just no way to make those things, enjoyable to read. Oh, sorry. That's okay. It's been, I'll be honest with you all, the local plan has been a bit of a frustrating process. Kind of the idea behind it was good. The spirit of it was supposed to be that we locally determine how we spend our funding and determine what services are important to our community. But I think given everything we're facing in the future with all the fiscal uncertainty, given the challenges the state is having with the Oregon State Hospital and their contempt order related to AV-CIS population, just sort of the landscape we're in, the local plan kind of just became a budget narrative that basically made sure we prioritized the populations we needed to, but thankfully in Deschutes County, we were able to still fund all the things that we had been doing as well. So that's not the case for every county across the state. Many of our larger counties, their aid and assist, civil commitment, crisis numbers are through the roof and vastly underfunded. So many of them are really struggling with how to fund the rest of their system. If we're required to make sure those core high level services are funded. So they're having to really shift money to make sure those priority populations are served at the expense of the rest of the system. And that is kind of our fear as well at some point, if our numbers continue to go up and our funding stays flat or gets reduced. That is a reality of how the current county financial assistance agreement is structured. It requires we prioritize those groups of people over everything else in the system, which is really in direct conflict with like the regional health improvement plan, and how the local plan was also supposed to kind of be linked with the regional health improvement plan as well, and really thinking about the larger system for our community. So they're just not in alignment, and that's a frustrating thing. So because of that misalignment, there's still no signed contract. So where we're at right now in terms of the county financial assistance agreements, it's been very chaotic at the state level around this contract. We were given a letter that said was it November 4th? Was the original date or 17th? There was a November date that they sent a memo out saying by, I think it was like November 4th or November 17th.
November for sure.
Okay, it was November 4th then. By November 4th, you need to let us know if you're gonna sign the contract or we're gonna start looking for another community mental health program. That was basically what it literally said that. We hadn't even submitted our local plan by that point, or we hadn't gotten any feedback on our local plan by that point. So we didn't know whether or not what we had submitted was gonna be approved or not. Of course, that sent the entire state into a complete frenzy. All the county councils and commissioners were pretty unhappy with that. The state got wind of some of the frustrations and the county's really digging in saying we're not signing then. And then they sent out another memo extending the deadline to November 24th. Again, yet another arbitrary deadline because it doesn't align with when the feedback is going to be received on the local plans or any other dates. So that was today, or no, that was that's tomorrow, Monday. Monday is November 24th. We're technically supposed to notify them if we're signing or not. I was in a meeting with the state yesterday and asked about that and said, how can we let you know if we're signing when we haven't gotten our plans approved? And they said, well, if you know you're going to sign, please let us know. But if you're still unsure and you don't respond, nothing's going to happen. So I'm like, well, we're not going to respond because we'd like to have our plan completed. We'd also like to make sure that the negotiations around the contract are complete. So the governor met with a small group of people at the Association of Oregon Counties Conference, mostly the larger counties. So I was not in that meeting because it is the larger counties driving much of this and rallying the smaller counties to kind of help support the messaging. And so that meeting did not go well. It was everybody sort of digging into their same places. The governor saying we're keeping the removal of the subject to availability of funds language out of the contract. They're not going to put it in there. The county council saying they're not going to sign unless it's put back in there. So the meeting didn't go well, but by the end they did say, okay, well, let's have another meeting. So there's going to be another meeting with a small group of people on December 8th. So we've got notify the state on November 24th that you're planning to sign or not sign. You've got our feedback due on December 5th. So we won't even know if our feedback's been approved yet. And then you have another negotiation meeting on December 8th. So none of these timelines are, adding up. Nobody knows what to do right now. It's a bit of a disaster. I'm still hopeful that it will come to a resolution and that a lot of this is just posturing and negotiation tactics and all that stuff is my hope. But our contract was supposed to be signed by January 1. So it's really putting us in a bind to get that to happen. And
all of the counties are aligned clearly, strongly.
Yes. Yes, I would say right now, all the counties feel pretty strongly that nobody's ready to commit right this second to signing. I think what we'll have to talk about when it gets a little further down the line is, you know, every county's gonna have to really take a look at their situation. You know, some of these smaller counties, the CFAA dollars are 100% their lifeline to stay open. A lot of these nonprofits. So if they don't sign the CFAA, they may have to shut down. Some of the larger counties have some resources, and like we do, we have resources that we could continue to kind of, you know, work on things potentially. We're also a CCBHC, which really complicates things because that's a separate certification and there's requirements that we still have to operate as a CCBHC, which is about 90% of what's in the CFAA. So it like, and then there's a really big complicating factor in that the state could choose to try and find another CMHP if somebody doesn't sign, but the local mental health authority has to approve that. The local mental health authority is the Board of County Commissioners. So this is not what we need to be doing as a state. I'm very, very frustrated right now with the Oregon Health Authority for putting us in this situation right now in the midst of what is likely to be the hardest next couple of years of, you know, most of our careers. And this is just not what needs to be happening. We need to be coming together right now. We need to be collaborating, problem solving. We should not be having this be the thing that we're fighting about right now. So, but nevertheless, this is what's happening. We're trying to just work the process. So at least local, I can speak for Deschutes County. That's the only one I can speak for. And that we are going to continue with our local plan. We're going to get our feedback from you all today and work through that process. We will get it submitted by December 4th, probably not much earlier than that because none of us have had time. And the other frustrating part around the feedback is, you know, we submitted a very robust, I think, very well done local plan. The feedback we got was in the weeds, nitpicky, like really just over the top stuff that if they had told us that they wanted, we could have incorporated in the first draft, but they didn't have any clue as to how to tell us to write the local plan. So now we're having to redo work. So a very frustrating experience. We've given them that feedback.
Set in meetings, you know, for 4 or 5 months, asking very direct questions and got a lot of vague answers around, well, we're not going to tell you how to do that. This is really your local plan. This is what you know, this is what you want to do with the funding. And then it was like, no, we need this, and that. Like, oh, yeah. And the questions, and you'll see when we go through it, are specific to like how it's broken down. Like section 2 is supposed to be what's funded by the CFAA. And the feedback we got is like, well, where's school-based health centers and where's, you know, family outpatient, which is not in the CFAA. Those come in separate service element. So it was very, frustrating.
Mismanaged, very frustrating. So again, we'll work the process. They're telling us our plans will be approved, which is another frustrating thing. It's like, okay, if our plans are going to be approved, then why are we now having to deal with all this feedback and rewrite sections of it and do all of it when you know it's going to be approved? So we're not going to go overboard on our response to the feedback because we're ready to be done. We spent 5 months on this process and it's taken.
Kind of makes you wonder if you just resubmit it as is.
It does make sense.
It did not, thought didn't pass me. I was, looks good to me. And Ambry has even said, well, let's go back to what the question is asking, because that's not the question that you are asking. You're asking for additional information that is outside of this question.
Right.
Yeah, there was, a specific section where I just called out, okay, but this is what the question asks, it's not aligning with your feedback. And then they said, okay, never mind.
Yeah.
Your section's fine.
They did. They actually,
They won't look at it.
I mean, it's just, so it's been very frustrating, but we're trying to just move forward and get this thing done and hopefully we'll have feedback pretty soon after the 4th is my hope. Because I would love to know by the time the governor's meeting happens on the 8th that, you know, hopefully they're able to come to some agreements or just a decision, if nothing else. Like either we're done negotiating and this is what it is, or we found a solution and we're ready to come together. We need this delay and extensions and all that stuff is just makes it difficult to do the work. So that's the long-winded way of saying that this is where we're at, but.
Well, it does sound like they've already earmarked every county with money. They're just making you go through the hoops to get it funded. but they're.
Everybody knows what they'll be getting. Yeah,
Yeah.
yeah. Everybody knows what they're getting in terms of funding.
Who's the governor's point person on this?
Well, Amy Baker is the governor's behavioral health liaison, and she actually used to be a community mental health program director. I love Amy Baker. She's phenomenal. And I mean, she's the liaison, so she only has so much authority in all of this, and is doing her best to try to get everybody to come together and come to some agreements. You know, there's some pretty significant philosophical differences in how this is all gonna play out. So I don't know.
Well, one other thing is that these plans are not technically due until the end of December. We chose to submit ours early, get feedback, and then be able to make the adjustments. Some people may not have submitted their plans yet because they're not technically due. So that is another complicated.
Scary or smart?
Well, yeah, I mean, we thought.
Get a lengthy list.
It was, and the feedback we got is, oh, you submit them, you'll get your feedback, and then they're due December 31st. And I was like, no, we want your feedback. What was it?
It's just been a moving target this entire time. So we're doing the best we can under these circumstances. I think we've done okay. We're gonna get our plan submitted. So I'll pause there for a second, see if there's any questions about all of that.
Is this very atypical of?
You know, it's funny because it was last year at AOC where we were exactly in the same spot around counties not willing to sign the contract because of subject to availability of funds having been removed. We ultimately won that battle and they put it back in. So this phenomenon of this language that is actually in statute. So it's in statute, but they've removed it for our contract. And so lawyers really get nitpicky about, I mean, understandably, because like oftentimes contract will trump, what's in the statute. So it's a known sticking point, which is why it's frustrating that the state decided in this moment in time to try to do it again when we're in the midst of so much uncertainty and turmoil.
What's their explanation for insisting that stay in?
It's tied to, there's a couple things. I think what they're saying is that it's tied to one county's use of that to get out of liability to support a person that was under community restoration. And apparently they couldn't talk a lot about it because it was a lawsuit and there's a settlement, I think, and I don't know any more than that. But there's a situation that is driving this. In addition to that, I also think a big factor in it is what we refer to as the Mossman order, which is an order that the Oregon State Hospital is not complying with statutory requirements to get people into the state hospital within a certain time frame. So right now they're in contempt, $500 a day per person per day for every person they're not meeting the requirements on. And so that pressure for them to fix that problem, they believe by having subject to the availability of funds in the contract, counties can say, gosh, I really don't have enough money to do this work, and so I'm not gonna help you, and then that puts the onus on the state, and they stay out of compliance. So it's a way to push the liability down to counties and communities. But the way commissioners look at it is unfunded mandates.
So and what she talks about that, the fine is incarcerated individuals have 7 days once they're in jail. Once a judge makes a ruling and the state is not keeping up, apparently they're following with us. We have a good relationship with them and our judges, but around the state, they're missing it by a number of days. So the only people that are using that fund, the state hospital, are basically, in order to go to the state hospital, you have to commit a crime and be in our custody.
Yeah. So it's important for the jails that the state meet these timelines. It's important for the individual's civil rights that they meet these timelines. So, but instead of the state truly solving their own issue with state hospital capacity management, but resource allocation to help communities be able to solve this problem, they're taking, this is all me just on my soapbox now, they're taking, in my way, kind of the easiest way out, which is to say, counties, you have to do this regardless of your funding that you receive. And then they can tell the courts, like, we've done it. We're trying to make the counties do what they need to do, courts. And so it's not how we should be working in partnership, but I think it's DOJ driving a lot of this. I think it's, lawyers who are not understanding how the system really needs to work to be the most effective.
And so hence you don't hear me arguing with her about it, only because it helps the jails take care of the vulnerable population that comes through. So when we know it's a problem, but it is taking care of the jails. And DRO we brought them into our jail system. That's why they're advocating for us.
Yeah, so I mean, and the hard part is that this actually isn't a huge problem for Deschutes County. Evan and his teams do a phenomenal job with this population. Our numbers have been going up pretty significantly each year, but because of the relationships they have with the DA's office, because of the relationships they have with the jail, because of how we do things in Central Oregon, we've managed this quite well. So even if that language, I mean, it's not going to change anything we're doing. We're doing a good job with it. But that could change for us. Our numbers could skyrocket through the roof one day, and we could be in the same position as Washington or Multnomah County. And then we have this language in this contract, and now that means we can't fund outpatient services or prevention type of activities or anything upstream. It would all have to go to this high level service, and then it just is a churn. So that's kind of the lay of the land. But you know, I'm still holding out hope. I think we're gonna get there. And each county will have to make their own decision at the end of the day. And so that will be, you know, a transparent decision that our Board of County Commissioners ultimately makes in a board meeting. So, but for today, more doom and gloom. I'm telling you, it's just like, there's this very little good news, unfortunately, right now, but we're hoping that will change. I will say the good news is that if our local plan is approved, and, you know, we do have the funding to continue right now, at least, you know, our existing service level, all the outpatient work we do in specialty care. So I thought we would take a little bit of time. I think I'll stop there and just kind of see if anybody has any initial thoughts they want to share about the local plan. Any takeaways you had, or like something that stood out to you, or something you absolutely hated. I mean, really, any of it's all on the table. I will say, some of us we have to keep in there, regardless of how any of us feel about it, because it may be required. But some of it is still very much adjustable.
You want to pass those out?
Oh, yeah.
Well, to start with, I got an email from Danielle McBain. She was planning on being here in person today, but she had an urgent work thing come up with some elected official. And so she emailed me her comments. Great. So would this be a good time for me to answer those as to get the conversation started? Great. All right. So it's, hi, Melinda. It was, and this is a lengthy email. It was anyway, general thoughts on the local plan. Generally a well thought out document, but obviously based on OHA's comments, some key components were inadvertently left out, and she doesn't have the benefit of the explanation of, yeah, some of that. Additionally, the overall document could use a thorough review for consistency, editing, and formatting. There were missing words in some locations that were key for describing what was being relayed in this sentence. For example, under CSS, it references the behavioral health team provided 7,300 something, but what is that? Is that hours, visits, patients? She didn't know. On the local plan required revisions that she has any knowledge on. Part 1, as a parent representative who also works at the largest FQHC in the region, Mosaic Medical, for those of you that don't know Danielle, I know we partner with the county on all SBHCs aside from La Pine school-based health centers. In the county. It looks like OHA would like you to list your partners specifically instead of saying medical sponsors, and it might be a good place to mention the FQHCs. Okay. I also know the county partners with Mosaic regularly on patient care and referrals. With both parties, the county and Mosaic being part of the I don't know what this means, OCHIN collaborative.
Oh, that's our Epic. That's our EHR system.
Okay.
Health records.
It seems to me that there is a data sharing agreement in place. Could mention that the street medicine partners, in quote, are under host, are providers from the local FQHC. That might give helpful information about behavioral health services and partnerships. I see that Mosaic and others is mentioned in the other local entities section. It looks like OHA is looking for the entities to be included more in the sections describing services in addition to simply listing them. Okay. Part 2, this is the end. Question number one, again, I believe the county does coordinate with Medicaid Behavioral Health Service carved out under CCOs under school-based health services.
This is the point of the question on 2 is really related to the CFAA. And school-based health centers are not in the CFAA.
Part of it, yeah.
So we put school-based health centers up in section 1. So it's really around that clarification of the question asked.
And you just even put PC above or something?
No, we in the new revision, all of that, and Mosaic is listed as well as the Pine Community Health Clinic, and it is in section 2, and we made that quite robust. But we go back to even in our meetings that we had with them, they were very specific. Section 2 should only be what's in the CFAA. And so we did not include things like young adults in transition, school-based health centers, child and family outpatient, because those are separate contracts that really don't have any bearing. We listed them above. But yeah, so she's right in that regard. And so we do capture it.
Okay.
In the revision.
Now, this is super helpful.
That's
Can you send this to, will you be able to send that?
Yes, please.
Anything we can have in writing to be able to track.
Plus, there's a correction.
Well, and OHA did say, like, please fix any corrections or grammar or thing, but didn't highlight where they were. I'm like, well, if we had known that there were problems, we wouldn't have submitted it. So if there's stuff we missed, we absolutely want to know about it.
Your 2 emails are not popping up to auto-populate, so I'm gonna send it to you and you can forward it on, okay?
That's totally fine.
And I'll send it to Dana too.
I have it. I can forward it. Oh, you have the email? Oh, perfect.
I mean, you can take the time to get your emails, but I wouldn't move on. Anybody else?
Yeah. Other thoughts from folks?
I thought it looked good. I caught the thing on the CSS portion as well. And then there's one box, I think towards the front end of it that you can't see all the information. It cuts off.
Oh, okay.
You have information in a box and it's like you can tell there's a sentence, but you just can't see the full sentence. But I thought great work. That was a lot of work.
A lot of work.
Yeah. Thought it looked good.
Thanks. Yeah, some of that might
Me
be,
too.
again, the formatting when it got transferred into PDF versus Word versus where we were collaborating online about it. So, yeah.
We expected feedback, but we expected, just any kind, we submitted it early because it is a draft, right? But the amount that we got and the inconsistency with what the questions are that you all have in front of you, and we don't have to go over them again, but what it was required in each section, they were very specific on what they wanted, but it wasn't, but the feedback didn't align with it. So in some areas it did, but for the most part in section 2, it did not, when it's specific to things that are not under the CFAA.
This is Linda. I don't see a raise hand function, so I apologize for just jumping in.
No problem.
I can only imagine the hours of sweat and labor that went into this. And for them to, I think I agree with the word nitpick. They kind of nitpicked a lot. Couple of general questions. I was wondering if when they talk about grammar and writing and all, and if that's where they're going to focus, that you all the report kind of switched between homelessness and houselessness. And I don't know if there's a reason for that or if you need to use the same word consistently, if the person is that picky. And the second thought, with the current administration not wanting to fund federally DEI activities, I know that you all have worked really hard to do all the right things the right way with that. But I wonder if it might be prudent at some point, or if the state even cares, not to necessarily downplay, but and not to leave out, not to be dishonest, but is there a way to talk about those and the activities and the funding that would perhaps not draw a budget cut related to those? Now that at federal, at the administrative level, they're saying they're not going to pay the schools and the universities and stuff for those activities. Just a kind of a politically questioning.
Yeah, no, it's a great call out. I think we're right now in a bit of a catch-22. Like if the state and the feds do not align on this topic. So right now, we are still contractually obligated to provide a
Okay.
robust array of diversity, equity, and inclusion types of activities. So for the local plan, given this is a state contract document, we opted to align with our state requirements. I agree, though, if any of these documents get submitted or reviewed from the federal government as it relates to Medicaid funding, we may have to adjust, or we may get guidance to think about things differently. We have taken the position, and you all can let us know if you collectively feel differently, but we have really taken the position at Health Services to continue the course, to do the work that we're doing until we get specific guidance otherwise. And when we get specific guidance saying what we specifically need to change, then we will have those conversations and adjust, because we can't lose our federal funding. I mean, we can't, we won't be able to serve anybody if we do that. But right now, it's just a lot of guessing as to what the federal government means by a lot of this stuff. So there are some organizations that have chosen to be more, if I want to say the word proactive, it doesn't feel like the right word, but more, careful or conservative in terms of their approach and like taking stuff down or wording things differently. I struggle with that. I think I totally don't blame organizations for doing that. Everybody's terrified. But I think I worry that even if we did that, we might get it wrong and it still may not be enough. And then we've gone through all of this like transition with staff and our clients and all of this that may be all for nothing. It may all get pulled back, or who knows. So Linda, that's why we left it in here, because we would have gotten dinged in our plan had we not put it in there.
It's hard to add that back in once you take it out.
Yeah.
And also the federal government's position, I think, is the subject of a lot of litigation. And so it's kind of like a wait and see about where they're actually going to land, because you're right, the administration itself is flip-flopping back and forth on
Whack-a-mole.
Yeah, it's whack-a-mole. And so it's probably better to stay course. I know that the Department of Education, or Oregon Department of Education, is doing the same as our local school districts. Like we're not gonna violate state law.
Right. To maybe.
Also, it sounds to me like the right place for that conversation, negotiation occurs at the state level. And that makes sense. I figured you'd already thought it through, but I just thought I'd mention it.
No, it's a great call out, and I totally can see why yes, absolutely. It's a pinch point for us, and we're kind of in the middle of like.
And there's strength in numbers too.
We're all in the middle of everything right now. Yeah.
Yeah.
Yes.
Okay, thank you.
We were intentional around language, like around harm reduction and some other areas that are not contractually required, and to make sure that we weren't drawing undue attention, right? So we were pretty thoughtful about that. But DEI is one we're not willing at this point. And it also aligns with, I sit on the Circuit Court DEI committee, and they're not changing either. So, aligns with other entities within the county.
Yeah. Other thoughts? Jack?
I do have a question for you. Are the commissioners involved in this at all? And what feedback have they given? What's that look like?
They were sent the local plan draft. I gave them a summary overview of kind of everything I laid out for all of the opening, and then offered to share the local plan with them if they wanted. I did get a request from Commissioner DeBonne to get a copy of it, so I sent it to all three of them, and I haven't gotten any feedback. They're very aware of all of the stuff surrounding it, and they're aware of the feedback we got that was really in the weeds. But I think overall, they do want to see our local plan be approved before even kind of considering any next steps. And I'm totally in agreement with that. That's like step one. There's still like 10 more steps after that, but like we need our plan approved.
What we gave you is kind of your Cliff Notes version, right? Of obviously this was the layout, but the Cliff Notes version of our priorities, our long-term plans, and then how we're going to measure those things on the map. And our interest today is making sure that we captured any of your ideas or perspectives, anything that we missed, right? That you want to make sure we include, or if we can, in the plan.
And the only thing I'll say to the metrics portion is that, as a CCBHC, we have a bazillion metrics that we're required to collect and report out on. The CFAA has a bazillion metrics we're required to collect and report out on. We have lots of other, like the CCO has metrics that we're, like between everybody, we've got a robust amount of data and reporting that we do. So when it asked us, what other things would you like to collect and report on? We opted to say nothing else right now because you can, there's only so much we can do. We did talk about between what where our metrics one is. So if you had ideas around that, I'm certainly open to hearing them. I only ask I would have is that it be high level, maybe in alignment with some things we're already doing, like, because our resources are not growing. In fact, they're likely to be lessened. And so the spending, it takes time and people to do all of those things. And we kind of really want to focus our energy on direct service.
So I have another question. This is Linda again. And it's maybe sounds kind of naive, and it is probably. It seems like one of the things that ought to be easiest to fix is getting people to and from their services when they live far away. And but I know it's not easy to fix. Has there been any effort to poll the community businesses, or could there be, to allow their different delivery people like DoorDash and some of those to have a volunteer cadre or some funding that those kinds of transportation could be used? I mean, they're used to deliver food, and maybe some of the companies or organizations would be willing to also use those services to transport people that can't get to the medical services and so forth any other way. It's kind of a wild idea, and I just thought I'd put it out there.
Yes.
So I sat on the non-emergency medical transportation committee for the last year and a half, somewhere in there. And alternative methods are being explored, like Uber, like we have medical Uber right now. The challenge with those is around liability, legal components, who's responsible if somebody gets injured, those sorts of things. Uber Medical, though, is something we are using. The position from many people within the state is if it is a benefit to OHP members to get rides through CET, through Modicare, and so when local community agencies are funding this, it is putting more strain on our system. So Uber Medical, for example, the reimbursement does not come back to the counties. And while we can weather that as better than some smaller entities, when Holly's talking about, smaller contracted places, they cannot. So you think about if we do that, then Mosaic is doing that, then Best Care is doing that, Rimrock is doing that. So we pulled OHA, had them there. We had consumers on this group. Actually, the majority of people on this work group were consumers and gave feedback. And there is currently some policy development at the state level. How quickly that occurs, I don't know, but they're looking at those aspects. I will also say that through this process, we looked at ease of reimbursement, ease of getting approval, language, and how things are done, giving information out both in writing and then through video as people go in different ways. And so there has been some improvement there.
Yeah, it's why the state and our feedback wanted us to get milestones and timelines on when we're gonna fix all these problems. And I'm like, first of all, we don't fix the state transportation systems for medically fragile individuals. So you tell me what your timeline is. I literally said that. And so we just what we chose to do is just add it to kind of long-term. It's not gonna be our priority 1 or 2, even though it actually is a pretty significant issue in our community for the people we serve. We have no control over how that gets solved. And so I can't put a timeline on it. I have to hope the state will step up.
Shameless plug is there's a third phase of the non-emergency medical transportation group coming up. And if anybody wants to be on that, you can let me know and I'll make a connection, because voices from our community are huge in that. So,
Well, if that could be in the minutes of the meeting, Because I would like to attend if I just know the time and the place.
Yeah,
'Cause there's a whole
at all.
cadre of foster providers, respite providers, and personal support workers, many of whom are already being paid by their employers and they're licensed and, bonded and all of that. There may be a pool of people already driving and being reimbursed by the county and state that could be deployed for additional assignments, and maybe the infrastructure may or may not already be in place for them to be paid properly and insured properly, just to throw that out there.
Yeah, Linda, we'll get it in the notes and I'll connect you with David, who is he's the outside entity that is hired to run this, and so.
Yeah. Thank you. I'd really appreciate that. Thank you.
But to be clear, it's all ran through the state. County's not giving any money for this program, right? It's all coming from the state.
It's all through Medicaid.
It's all through Medicaid reimbursement, so, yeah.
I didn't think any of it was.
But they are looking at like, would there be a way if they're using Uber Medical? And when we talked about Uber Medical, it's, our transportation is Monday through Friday, 8 to 5. Or when somebody has a 6 o'clock appointment or has a 7 o'clock appointment at the school or needs to go to an appointment on Saturdays, because a lot of clinics are open on Saturdays, those are not resources available. So how does the state then reimburse those entities that are paying medical Uber?
And then there's other challenges with the medical transport around houseless individuals not having an address, and this being our most vulnerable population that really needs a ride to some of their appointments in order to do, get help. And there's just a lot of barriers in the system that need to be resolved. And I think it's just a system that was designed for a particular population a while back, and our population is evolving and our systems need to evolve. So. Anybody else online or in the room, thoughts on the local plan or the metrics or the gaps?
I learned a lot reading through this.
Thank you.
Thank you. And generally pretty digestible. But I'm sure a tremendous amount of work. And I don't feel like I have the expertise to give any like particular feedback. I was curious about and there was some spacing and alignment issues that somebody already mentioned, but I was curious about, it looks like a lot of years you were addressing were 23, 24, which is great. Like you did point in time, 24, a couple things from 23, but then you have one graphic, I can't remember where it was, but for 2021 for suicides in Deschutes County. And I'm curious, what's that about? And is there a way to like have things as current as possible?
Oh man, do I wish. Yeah, suicide data is lacking. It's
Because we have it for youth suicides, right? We have that pretty current.
And there's always a lag with suicide data because you have to go through the state.
They're preliminary, and so.
Oh.
So we get nervous about releasing numbers that are preliminary because it could change for one, and the numbers are small, and so then we also run into issues around, confidentiality and.
They don't publish them formally until they've gone through the whole ME process and ruled everything out, and it takes a long time for that. So sometimes you will see things that are preliminary and other times you won't. So that was, and we pulled that data from the RIP, and so Regional Health Improvement Plan for most of that, or public health, and it's their final data.
Yeah, the numbers that people in the suicide prevention space are willing to print are usually the ones that come from the state, and the state is several years behind in terms of the vetting process in which to make sure that those are as accurate as possible. It's not, they're so less helpful when it's 3 years. I mean, like,
yeah,
I'm not sure
well,
what it is a suicide data trends when it's from 2021. Like we're
just catching up on the COVID stuff.
Yeah.
We tried to give the most current information in the appropriate categories that we had, but they don't always line up.
Yeah, okay, I was just curious what the reasoning behind.
No, that's a good question.
It's a great call up.
Yeah, we go round and round about that data a lot of times, and it's, I mean, I see both sides. You want it to be accurate.
Right.
And
I mean, I think it's powerful at the point in time and just 2024,
Yeah.
right? But it would, if I saw something for 2021, I'd be like, that just
that's
doesn't
not
jive.
It doesn't, because 2021 is a very different time. A lot going on that year.
So the data is collected from the hospital, you guys.
It's collected from a variety of ways. It's their medical examiners, and then we, first it has to go through the police to even determine if it's a suicide. And sometimes that can actually take months because, as you imagine, when you're a district attorney having to evaluate number of deaths, you know,
I could be here.
it can be months oftentimes. I mean, they want to be thorough. They don't want to rule something a suicide if it's not a suicide. That's, you know, it's murder or something else. But then they've also got really active murder cases that they've got to be working. And so they don't often like take the top of the list.
So you're taking them from the medical examiner mainly because all our data goes there.
We get a medical exam. We get, well, actually, the way suicide prevention works so you all know, when an officer arrives on scene at a suicide, they actually contact the mobile crisis team and let them know in real time of a death by suicide. And so that allows us to then begin the process of postvention work, which is really us reaching out to immediately affected family members or friends so that we can work on preventing contagion and offering resources and support. Our suicide prevention team in public health does that. So this is really where the public health behavioral health partnership is strongest, I would say, is around our suicide prevention work. And so that kind of initiates the process. And then we get the medical examiner's report that gives us some lots of data. And then we also eventually, usually a couple months later, get the police report, interviews and so forth from the district attorney's office and the police that help provide some additional information so that we make sure we didn't miss somebody, that we can do if it's the client we've served. Here we can do an internal review to make sure we didn't miss anything. There was, you know, any supports we need to offer to anybody else. So it's pretty robust process we have here. We're only required to do all of that for youth. But we have made an intentional decision in Deschutes County to do it for all ages because our higher numbers are actually adults in terms of suicide.
And report out and tracking for youth is, we tend to know more because of that. Because we do the annual review with the Kid Center and local law enforcement and the ME's office, public health, behavioral health, and we go over every youth death under the age of 24.
Regardless of reason.
Regardless of reason. And then our suicide prevention does the specific for youth that are under 24 and under for suicide. So, and we look at everything, bicycle accidents, car accidents, the impact, what could we do to prevent it? So we tend to have a little bit more of a local pulse on that because of that connection.
Anybody online?
I had to step away for something right at the end of the transportation before this part of the conversation. Sorry. So if it was already answered, ignore this. But going to the transportation piece that Linda had brought up, and I saw that in there. If this helps with what you're talking about, Holly, in terms of that kind of metric, I know it says in there looking at the access to care metrics are there any transportation specific or attendance based metrics you have or could put in there? Would that help? And if that's already been answered, you can ignore me. Sorry. I apologize for having to step away.
They're tracked at the CCO level. We actually don't get them at our level. And then they're tracked at the CET level. I'm going to meet with the transportation level. I'm meeting with the CET director on Monday. We're going to talk about kind of a myriad of things, but one of those might be how we communicate on those some of those metrics. But right now we don't have them. I think it's a great question, Lily. We can get them from Pacific Source, but they track primarily complaints and then outcomes of those complaints.
Yeah, and we do standing orders, and I'm sure in your grievances and conversations we've talked about this. The process within that has its strengths and barriers, but the metrics are flawed. Like what they ask, we give them attendance data, but like it doesn't always match, and there's discrepancies between what in terms of what we say to match that stuff, and so that's where the thought came from. Was if when they're asking us to verify, did they make it? What they do with that information, yes, no, is up to them. But that's just a thought, because yeah, it would be nice to smooth that out. Thanks for being able to work on that.
Yeah, and there's been a lot of discussion in that work group around accountability, not only to the transportation provider, but also to the CCOs monitoring or contractually responsible for setting up those brokerages. And making sure that they're closing those loops. This is where, when I went to that meeting saying like, this isn't my contract, right? And CMHPs are helping people access those services, but I have no say and no leverage to be able to go in and say, 15% of our population didn't get rides last week. And so the outcomes of that. So we asked the state to reform that, and
That really needs to happen, because what we've been advised by CCOs is, well, to keep submitting those grievances, and, we won't know unless we have the grievances. So we flood them with the grievances, but we haven't seen.
Yeah, we're preaching to the choir on that, yeah.
Maybe just me, but I was very specific on that accountability needs to happen at the contractual level.
Yeah, but I was just wondering, I know a lot goes through that, but is that access to care timeline metric I saw on like page 39, because you talked about the transportation piece in there, is that how you guys will try to measure that, just in terms of bridging what I saw? Like, does that help? Because you point that out in there at the end, the graphic about 1 in 5 missing and reporting the difficulty, but is that going to help your part with what we can show in that, in terms of how we can help that angle? Because you did highlight that problem, and then others are responsible for solving said problem. Because I hope we can support that, and and we've had the same issues on our end, so thanks, guys.
Yeah, I mean, we're just grateful Shannon sits on that board, because I think that's our best bet at actually getting to, or that work group to actually make some traction and get our voices heard kind of at that level. We've been trying to work on it locally for a long time, and I think it's just a bigger issue that we can solve locally. I'm sure from the CCO perspective, I mean, there's probably just not a lot of providers. I mean, they have workforce issues in the transportation area too. There's, not people lining up to do this work. So it gets really tricky to hold people accountable in a contract when you don't have probably a lot of other options. And so, not that that's an excuse, but I think it's a statewide issue. Yeah.
So this is Linda again.
Yeah.
This is so incredibly naive. Try not to laugh, but I just wonder, do people, all the stakeholders and service, ever get in a room and just look at themselves and say, what's so hard about somebody who's willing to drive somebody, saying yes to it, and what's so hard about connecting those with people who need a ride? And I guess, I mean, I know it's hard. The what's so hard, of course, is what we're seeing in all these documents. I'm not trying to be belligerent, but I'm a foster provider, and those of us who've done this, well, we have a heart for helping. And I don't know how many foster providers, respite providers, caseworkers, people who are already engaged in the community, we've been background checked to the nth degree, would say, sure, I'll give somebody a ride. And then constructing a pathway between that and what it takes to make the ride legal. That's the end of my preaching for the day.
Well, I think
Thank
those
you
are
for
valid
listening.
points, Linda. I think there's probably a handful of people like you with a big heart that would raise their hand to do that. And so the logistics of connecting all those people, finding out who those people are, creating a registry, keeping it up to date, that is definitely something that could be explored at the state level. But I think there's also a population of people that nobody raises their hand to transport. They're incredibly dysregulated, psychotic, or safety issues. They may influence. They it's just not your just typical client with a mental health condition or something. So there is a population that we really struggle for anybody to raise their hand. Sometimes even our own peer support specialists who do transport a ton of people, but there comes a point where there's a safety concern that makes it challenging.
Oh yeah.
There's training requirements, there's auto equipment requirements, and that reliability is insane. I can't even imagine.
So it's infinitely more complicated than meets the eye from my point of view.
Okay. Well, everything is in government.
I know. I used to be one. Well, thank you for listening to me again.
Thanks.
I have a question, and like Cameron, I feel like I learned so much through this document, like.
That makes it worthwhile right there.
Kind of what I've been thinking of, you know, when I attended the FAB retreat, they were talking about doing a menu of services or a mapping of a resource map. And I'm kind of like, well, this kind of gets me a long way. So learned a lot of acronyms that we all have to learn. And so one of my thoughts is let's do a map of acronyms. But I was shocked to see, and perhaps I should have known this, that 58% of all Deschutes County death among 10 to 17-year-olds were due to suicide.
Very high suicide rate.
Double than the average.
I
Yeah.
had no idea.
Yeah.
That's crazy. There was a comment in here that it says additionally, crisis stabilization rules that limit 23-hour stabilization without parent involvement pose barriers. Is that a Oregon statute, reg? What is that? What is that rule?
The 23 hours or the parent involved?
The 23-hour limit without parent involvement. As I read, that's what it is.
Yeah, it's a licensure piece in terms of how long. And Nicole can probably, oh, she popped off. But in terms of parent involvement, parents need to be there if they're minors under 14. They make some provisions over the age of 14 because they can sit on their own. But the stabilization center is all adults too, so it's not the greatest place for minors to be. But,
Yeah, well, we just ran into sticking issues at 14 and younger, and really just, in a crisis, if a kid is suicidal and they're 13 and they're in a crisis, we're like, we're gonna support that kid regardless if their parent is around or not, like, we're not gonna let anything bad happen.
But it's for 23 hours, it sounds like.
Putting them in a recliner for staying for 23 hours, we gotta find, parent needs to be aware, they need to know where their kid is, they need to be involved in that care. And so there's just extra challenges with that. And I would say our unit right now is absolutely not set up to support youth in that space. It's 5 recliners in one room it's just all adults. So we would need a separate unit, which we've talked about, and there is a pathway to do it. We just don't even have the resources for what we have now. So
3 hours though becomes like, if it goes to 24, it becomes like an admission, like a
24 hours.
You should stay, and then you fall under different rules, and so the 20, that's why it's 23. So it's complex in terms of age, and then also kind of mandates for, is this residential or is
Type of
this
treatment.
respite?
Licensing is coming into play after 23 hours. So.
Otherwise they go to the hospital.
And just for clarification, I think there's kind of some misunderstanding about what the residential facility is going to be in Redmond.
Yes.
Is not necessarily for stabilization.
There will be
So
some.
will they have,
Crisis beds there.
how many will it be?
We talked about 4 to 6 crisis beds and
Okay.
then the rest are subacute.
And we're.
So it basically will kind of,
meet that need a little bit.
it'll mirror what's happening, just the one section of it.
Yeah,
And then the rest is long-term residential.
Yes. Yeah,
Residential, it's
Acute care.
it's acute care, it's subacute, it's one
Versus
step
acute.
under an acute care hospital.
So
So not like 4 to 6 months.
Typically acute or subacute care is around 90 days, and so, or less, and it has a medical component to it. So it's not just psychiatric. So somebody who overdoses that maybe needs some monitoring because they did some injury to their body, somebody that needs a medication wash, that needs psychiatric care, nursing support. Maybe there is some, sutures or injuries. So their needs are a bit more complex. So you think acute care, which is the hospital level, and then this is a step down, and it's a bridge gap. So in that time, in those 90 days, if we determine that they needed psychiatric residential care, then we'd be looking at, do they need to go to the state hospital level of care, Children's Farm Home, or Perry Center, and working.
Okay,
Yeah.
there's a lot of mixed.
I would tell you the majority of use needs can be met in those 90 days. Especially, we tend to have kids languish in care longer because they're over the mountain and we can't work with their parents in the same way. And, the parents are separated from their kids. So that family component.
I think a lot of people think this
integrate
is
them
like
back into
another
school, all of that.
when we get a little
Yeah.
closer to like first of all, finalizing the land and the funding and the contractual arrangements, then we're gonna start sitting down to like really like map out the model. Because these crisis beds, we're talking about 4 to 6, but we've also talked about it being a fluid type of facility, that if we have more crisis needs one month, then we might have more. If we have more residential needs one month, we might have more going that direction. So it's really meant to be it's gonna be licensed at the highest level, but we might use it in a variety of ways. So
I'll
that
tell you that nobody else in the state is doing this model. That's not shocking. It sounds crazy. Like to be different and carve out our own thing. So,
it is.
so.
But also to have that fluidity is.
Yes.
Yeah,
It's
we're-
critical for a county our size, I think, because we're
Yeah.
gonna have different needs and we're never gonna have a huge volume of all residential. We're never gonna have a huge volume of all crisis. So
we're
having.
trying to do something that meets our community needs, and I think it's gonna work. But it's not been done. But we're gonna make it.
Huh?
15. Yeah.
It's all kids.
Okay, I have one other question, and maybe I'm missing this somewhere, maybe you already talked about it, but that last question of theirs about technical assistance and training.
Yes.
Even if you don't necessarily need it or want it, is there a reason you don't answer it?
Well, we did, I think in the actual document, we did, we mentioned, I think the only technical. Do what?
You said you didn't need it for one, and then for the other, you said you would need it.
We might need it, I forgot what.
That given the gaps in rural access to ESAA services and OHS and assistance lead by, that's a typo, by OHA is needed to formalize services in those areas.
That's technical assistance that we can use from them. We need
And the
technical.
one below that is around ESA specifically. If you go to the second question, what training technical assistance is needed from OHA to support county implementation of their local plan?
Oh, okay.
So there is on there our ESA program, Early Assessment Support Alliance for individuals experiencing their first episode of psychosis, is a tri-county program, but it is not funded to be a tri-county program. When it started in 2008, we were under WEBCO, which was a tri-county kind of a MHO model. I would even, anyway, and it was a grant, and they applied for it as a tri-county entity. At the end of that grant, Deschutes County became the lead continue to do these services, but there was no funding affiliated with it. And I've been in the program the whole time, but not at.
So since then?
Well, I started asking like, where's our money for this? And they're like, oh, you're not a tri-county. We don't fund you for that. We always wondered why you did it. And I'm like, we're not doing it then. You need to start one, so.
But we also don't want to leave.
We're not gonna leave them high and dry.
Yeah, it doesn't help our region to have.
That's right.
No, we're not. And
So
so.
it is a little opportunity to do a little some nudging.
Opportunity, and so.
Please help.
Yeah, I've met with Rick and Melissa who run Best Care, and they're like, yeah, like they can't do this on their own. So could we either, one, they either need to fund us to do it, or we need to create a hybrid model where they're treating someone in their community, maybe with consultation from us. We don't know, but that's where we want them to show up.
I see, okay.
Because right now, we have 2 ESA clinicians and they're covering everywhere from Warm Springs all the way down to Gilchrist. And it's like 3,500 square miles that's their catchment area.
It's been half their day driving
Yeah.
and I can only see one person in the day, it's just not, it's not.
It's not a great use. And the idea is that someone is supposed to have psychiatric support, case management support, family partner support, nursing,
I
occupational.
mean, we've had our medical director driving to Madras to go see an ESA client before, like that. Is not a good use of resources.
So that's what takes.
Actually as technical assistant.
Yeah.
That's what, I was like, I'm putting it in there. But we're not gonna leave them high and dry. That would be awful to the hospital. I mean.
Well, it ultimately would hurt.
All of us and our whole community.
Yeah.
Yeah, so.
But other than that, I mean, honestly, OHA is not.
I believe it. I believe it.
We just kind of,
It just seems like they're so nitpicky. I'm just, I feel like throwing them bones might be something, but I don't know.
I just,
It would result in another meeting.
exactly. And
Or keep this ball rolling. Or not, yeah. Okay.
This was super helpful.
Is it helpful?
Yeah, thank you. No, I mean, it's just nice having you. I thank you for reading it. Thank you for, being interested in this document. I'm glad you learned something from it. That really makes me happy because and OHA claims that they learned a lot by reading these. So we'll see. We'll see if that transpires into like actual change and understanding our local communities. It was it's an evolving document. This is not a static document, I suspect, as we go into the next couple of years and funding cuts start coming our way or decisions get made about what we can or cannot do or other things that we will have to adjust this document in real time, but we'll be bringing that back here. We'll let you know what's being changed. We'll have a discussion about it and but it'll be an evolving document. And it really has to align with our budget. So any changes we make in our budget then has to be reflected in our local plan.
Are you gonna share this once it's complete with the?
Yeah, I was gonna share with the CCOs. I mean, they wanted us to do a part of the requirements to do a robust planning process. Well, we didn't have time for one.
Yeah.
And everybody had just gone through the regional health improvement planning for us not that long ago. So and we took a lot from what was done in the RIP and incorporated it into here so that they're in alignment. But obviously, as we continue to develop these, we'll be more intentional about bringing people to the table, about, the system. The hard part is I feel like it sets people up for frustration because people are going to come to the table. They're going to talk about all of the things that we see locally in terms of gaps or what we would like to work on and where we'd like to see the funding go. But we don't really get to do that. That's not how
It's like, to have all the flexibility, we're just gonna give you your money and you can determine how to spend it in these categories.
for these people.
For these people.
Yeah. So I just want to make sure people's expectations are set.
I think the document, I think it's great, and I think it's a great way to show all that you guys do.
Yeah.
I was like, ooh, I want to get this to my team so they can see how robust and all the different things that the county does. So if at some point it's shareable, I would love to.
We'll probably put this on our website, quite frankly.
I think you should.
Well, yeah, once we get the final absolutely approved document, let's just make a note that we'll put it on the website in behavioral health section. I'll also share out with them, a list of community partners so that people understand what we're doing.
I think it's great.
Yeah.
Easy to read and.
Oh, good. Thank you.
Good information.
Good visuals.
Oh, good. Thank you. We got good feedback on it too. And I will say the feedback that we did get, the nitpicky stuff, everybody across the state got the same. It almost looked like they copy and pasted the feedback. I mean, it was
Probably not gonna read it when they get it back.
Oh,
What
interesting.
did they say about our metrics to you, but then our feedback was.
The data, actually, they said our data, that we had one of the best documents in terms of the data that we incorporated. In fact, used our plan to give to other counties so they could see how we incorporate the data, but then gave us feedback on our data. So I don't know.
Good for telling them part of it.
What do you do?
That's okay.
All you can do is laugh.
Holly, this might be real naive, and so bear with me, but I feel pretty defensive of you guys. Given all the work that you've done and how ridiculous this bureaucracy stuff is, including the CFAA, but is there a role for our group to advocate in terms of the process and the rigmarole that you guys are having to go through, or maybe we align with other counties' behavioral health advisory, because we're a statutory committee? I just don't know. We talk about advocacy for positions in the legislature and some other agencies, but not necessarily on this kind of thing. I'm just wondering if there's a role for us.
It could be. There's a bill that went through last session that ended up getting so watered down it didn't actually do anything. But it was around aligning local plans. It was around cause the CCO goes through a local planning process. The Central Oregon Health Council goes. I mean, we have more planning processes in this community, and the fact that Best Care had to do their own for both Crook and Jefferson, when we operate as a region, and how do we collectively do one plan that allows us to still meet the needs of each of our local counties and local areas. And that's what this bill is trying to do. And I think they're going to try to make some tweaks in it. I don't know if they're going to do it in a short session, but they may try to do it in a long session. And then I could really see there be a role for advocacy, testimony, letters of support, something along those lines that really say, and I honestly, we're going to be working with the state over the next 18 months if we do sign the CFAA around adjusting the template and paring this down, because this was ridiculous. And so we're going to be providing that, but we just kind of needed to get through the first one because we're on such a tight timeline that nobody really knew what they were doing. So we hope to have lessons learned on this. And if there's opportunity in that process for you to write a letter of support or advocate, well, I'll certainly let you know.
Also, anything that comes up regarding administrative
Yeah.
burden and because reporting is in that and we talk about duplication of reporting, like we're looking at how it's tracked. We have literally hundreds of reports that we send out. I think my team has like 14 that we send out when I'm in my program manager role. And so there are 7 other managers that have reporting. So if you ever have an opportunity to do that, really looking at what does that do to our system? Yes, we want to be accountable. We want to present metrics. We want to have good outcomes, but there's redundancies and
we're submitting all of this to the state, and to date, in my 13 years with the county, I've never gotten anything back from the state that says, here's what your data shows us as it relates to the rest of the state. Here are trends we're seeing in the data across the state. Here's what we should be focusing our resources and attention on. I get nothing. So
Easy work for you guys that goes nowhere.
I wonder if anybody's even looking at it. And so we've given that feedback. There's nothing I haven't said directly to the state. So I'm not talking behind their back. I literally have said it yesterday. And so that is an area of focus that we're trying to push at the highest levels to say, if we're going to do all of this, at least use it and give us meaningful feedback on it so we know where we're at and if we're doing good things or not. So that could be an area of advocacy as well. There's going to be some advocacy around Evans programs for sure. They just implemented a whole bunch of stuff for the aid and assist population that's causing enormous burden for Evans teams on tracking individuals that are in the community under community consultation. So we're going to try to change that. There could be, we'll see how that goes.
Anything else? Anybody online have anything to offer? All right, do you have anything?
No, thank you all so much. Really, really appreciate the feedback and support too. Just commiserating helps as well. Yeah, thank you.
All right. Well, what else do we have here? So we have some time. It is 1:13 and we're scheduled to go to 1:30. The only thing else is open discussion about any business for VHAB that you guys might have. I want to start off by saying that I attended, some of you may have heard, FAB is the Public Health Advisory Board. So it's our counterpart on the public health side. And they had a 2-hour retreat earlier this month that I attended as a visitor. And it was pretty interesting to see how they function compared to how we function. And it's they're going in a direction that I think Lee and I would like to take this group to make us a function better, a little bit more clear about what are we doing besides just meeting once a month for an hour and a half. And so I think Lee and I need to organize our thoughts a bit and bring some ideas back to you. They have a leader named Tom Kuhn, who is he's more of an active, he strikes me as almost like more active than their board chairs in some ways. Like he's like, that's one of his roles. And so he's a good ally, and there are certain topics and issues where we can align with FAB, they call themselves FAB, on a number of different things. So Lee and I will be bringing some of those ideas to you and some organizational principles. But they did a document, which is kind of a menu of options about different ways that they could function. And so I will bring that to you guys, and we'll want you to just ruminate about it. I'm thinking probably in January, once we get through December and the local plan and the CFAA and all of that stuff, I think January will start us off on a different track where we can start looking internally about what we're doing, how we organize ourselves, and who we want to be when we grow up, because I think we're going to grow up here a little bit. So just kind of be thinking about some of those ideas. Cameron, I think you sent out an email. We need to recruit some more members, I think. Yeah, we've got one here that we are going to be working on.
Yeah.
So hopefully this didn't scare you off today.
No, I'm really impressed with all this. Yeah, this is, wow.
Yeah, I think our challenge.
Just a little history.
And ditto on the acronyms. I mean.
Okay, maybe I'll create like a list. I have a binder. I do a lot of special education work. for our school districts. And when I got hired in my job, they're like, you're gonna be specialized in special education. I'm like, okay. And then quickly realized I have no idea what I'm even reading. And so I have a binder full of acronyms for special ed, and I find it helpful, and I take it with me everywhere I go. So
I just a history on, I mean, I don't think anybody is on this board that was on it back in the day when it used to be heavily run by the behavioral health director. It was led and organized. The agenda was set by the behavioral health director. And I'll just be, I mean, it can also depend on the makeup of the board and how engaged people are, but it became a very check the box activity with less engagement from the board, because it was just sort of people showed up, the director did everything, and then we all went home, and it was bye. And so there was like an intentional shift away from that to have the board have more autonomy and really lead themselves. And there's pros, sometimes that can be challenging when you don't know all the topics and the different things. So anyway, it's been done a variety of ways here. And if there's other ways to do it, I'm really interested to hear from public health, how they're experiencing that as well.
yeah, I think that will be an interesting conversation. I'm less inclined to go that route only because I don't want to put more burden on you guys than you already are.
It's effective, I don't think. I think, I mean, the discussion and it really feels now for the first time in the history of my being a part of this, is that the advisory board is really deciding what are the areas they want to focus on, and what are the topics, and what are the focus areas and subgroups. And that just feels more meaningful as for the behavioral health director to know what you all are interested in and working on, and how we can support that. So yeah, I feel like it's a nice balance.
So we might, Lee and I haven't talked about this, but I think we probably will organize some kind of a retreat the first quarter of the year, maybe just for that purpose. And by a retreat, I'm not talking all day. They only did 2 hours for FAB. So it's, and they kind of got a little bit off topic, and, which I'm going to probably try and keep us really on task, not waste your time, and keep focused on that. But just some things to think about. I would like to get some more work on our membership first, and try and maybe bolster that, so that if we go into that type of planning, strategic planning, we've got people we've got a robust group. So would you guys all interested in doing some kind of a retreat? And keep it short. It's not like a half a day. Okay, so anything else for the good of the order? Yeah.
Yes, December, they're gonna move to remote.
Oh, that's right.
I'll update the invite. We just decided that yesterday. And I do have a list of acronyms, so I can send that to the group too.
Thank you. That'll be super helpful, especially with all the organizations. Like even reading Danielle's email, I was just kind of going, I'm not sure I'm following. I'm just reading. And then the other thing that we should talk about, and this will probably be a larger strategic planning part of it, but think about how often we want to meet, what our schedule looks like. We're a statutorily required board, but it doesn't prescribe. I think we have to meet, I think there's something in the statute, and I can't remember. We have to meet like
You want me to 12 months or something?
something like that, but it's
It's not
not,
bylaws or in statute.
I don't,
I don't remember there being much in statute, but
I think it's in the bylaws.
it might be the bylaws, yeah. And we can always change our bylaws. Bylaws aren't set in stone. That reflects what we want to be as an organization. And so, I would encourage you guys to look at the bylaws and be familiar with it. We'll have a better opportunity as we get closer to our strategic planning and retreat to kind of go over that, to see if there's any changes that we need to make. But think about what works for schedules. If we have to have 8 meetings, for example, do we want to alter, do every other month, and then maybe double up on 2 or 3 months, whatever, to get to our 8? Or do we want to take the summers off? Do we want to take December off? Some things like that. So just, we'll be asking for your feedback on some of that. So stay tuned for some further work. Thank you.
Sorry, I have to be out for 1:30, but I do want to do a plug. I don't know if everybody saw my email, but if you know of anybody, particularly those with lived experience, of all ages, and that we're really trying to recruit. And us, it doesn't have to be lived experience, anybody who wants to engage in this.
I did a plug for it just the other day. I did the City Club presentation, and there were people that came up after and were wanting to know how they could be involved, and I let them know about this
You
board.
did? Okay.
Yes.
I haven't heard, so hopefully, yeah. And that page, I sent that to you, Carrie, I think, I don't know if the page that talks, it's been cleaned up a lot. And I think so if you could just shoot that to friends, that'd be really great. Parents, adults of parents struggling, anything. I just we're just having a hard time generating.
Okay, we all have a task to at least mention this to, let's call it 2 people in our lives.
Thank you.
People before the December meeting, and then Cameron, you're in charge of the membership, and if you need any support from us, you just let us know.
I'll be sending
Okay.
another email soon.
Okay.
And then Eric Breon and having them do like a little blurb. Did we find out about that?
When did we talk?
This was a while ago, like in our brainstorming of how we could do that and using county media. to-
Yeah, oh, well, I mean,
Forms and-
podcast, I mean, the county, I just did
I'm saying we, a podcast and then getting it on social media, you could do a social media campaign.
That's true. We could have a little blurb about just flash it on our county web, Facebook page.
Yeah, on your handout, we can do that. Yeah.
If you would like us, Eric Brown is our public information, one of our public information people, and so we could invite him to a meeting.
That'd be great.
And so you let us know when you want that done, and we'll have him come and he could hear ideas and start to brainstorm with all
I
of
did a
them.
podcast and it wasn't bad. I mean, it's like pretty simple.
Yeah.
I mean, I thought it was gonna be awful, but he has a little room.
He does. I just did one too. I thought it was, yeah, he's really
He's
good.
actually a multi-Emmy award winner. I don't know if people know that. He's won like 5 or 6 for news reporting. So he makes you very comfortable.
He knows what he's doing.
It's like this.
So do we have, I mean, December, we're gonna probably be focused on a director's report again.
Mhm. We
Right.
probably should have, God, I hope we have some answers by then. Please, not let me go into the new year without, so yeah, hopefully we have some answers by then. I don't know if we'll have a lot. I mean, it'll either be like, I mean, if we're not signing, lots to talk about. If we are, then it's sort of like we won't have
Nothing at all to talk
or
about.
nothing at all. So we might want to have some other ideas on the agenda for December.
Okay, so
So
with that,
this is
maybe-
Linda raising her hand out here, sorry.
I'm sorry,
Um,
didn't see it.
No, that's okay. There's not a raise hand function, so I'm doing it. I was just wondering whether they would be a member or a guest. And once the plan is pretty finalized, which it sounds to me like it's close enough, it might be interesting to look at resources connected to the biggest challenges in the plan. Like, would we want someone hooked into the whole transportation world in Central Oregon to be a committee member, because that's a big area of need, and see if we could specifically recruit for certain roles that would have knowledge and resources that would benefit the gaps, were our biggest gaps. Just a thought.
That's a good thought, Linda. And interestingly, FAB does it very differently in terms of their membership. They allot their board membership, and this is new this year. They have somebody from, like, they categorize what their needs are from different community type organizations and industries or service areas. But they don't have a mandate where they have to have 51% of lived experience. And so we have that overlay that we have to make sure that we're maintaining even. And so I think that with this group and recruiting, we're probably going to have to do it a little bit more organically than what FAB does. But it's a great thought that, if anybody has specific interests or, I think it's organic how we probably have to do it for our group just because of that requirement.
And I don't, it would be a stretch, but maybe not impossible, to ask someone who has lived experience trying to make it around Oregon without their own wheels. They might be actually working in that industry. I don't know, just a stretch.
Well, if you know anybody.
I don't, I wish I did.
Yeah, but if anybody thinks about that, that's, be thinking about the gap areas and the needs in the local plan, and try and, use that as a launch pad to think about who in your lives might be interested. My impression is that the 51% that we have to have for lived experience is not hard to meet. I mean,
Okay.
among us.
1 in 3 adults have mental.
Is that what it is?
Yeah.
Of themselves or?
Of themselves, and then, I think we all probably in our lives have family members or friends or somebody who's, that could be anything from mild depression to anxiety to psychotic, it covers the whole gamut.
Yeah, so it's.
Some sort of disability.
Yeah, I don't know anybody who doesn't have somebody in their lives that has experienced it. So I think we just have to identify it. And track it, exactly.
I would like to put another date to come visit the jail.
I would love to do
as a
that.
team, and I think you would really enjoy it, especially with you guys coming in because we share the same clients.
Yeah.
So
I think that'd be great. We don't, unfortunately, Julie McFarlane is moving to Salem. And so she's gonna be leaving our group. I just said, look, we know you're not coming, you're not, your future's not here. You don't need to be coming to the meetings right now. She's got a lot going on in her life. But we'll have to talk about how we incorporate, we call it outreach. I don't know if we want to keep outreach or not. I don't know if that's a function that we're gonna want to do. But I do think that that would be a great opportunity. And so we could do that sooner than later, and I can take charge of trying to schedule that if you would like. Is there?
Send me, I'm very flexible. So
Okay.
just send me an email. I can get the whole group through.
Yeah, is everybody interested? Have you all been to the jail? And I have through Leadership Bend, but I haven't, that's been years.
Yeah, and then the jail is so, I mean, it's a inner city, so if you've been through it once, you probably only picked up 10% of all the things that come through. And 92% of all the individuals that are in custody today have nexus to drug and alcohol and mental health. So that's.
Would it make sense to meet at the jail and combine the tour with a meeting?
Maybe at the Mac Center.
We can do that.
Could we do that?
That would make it convenient.
That'd be great. Maybe we can do that in the first quarter of, not December, probably not January. Lee and I have to kind of figure out what we're doing next, but maybe a February or March meeting. And you have space over there for us to meet?
There's a nice big room there, the Mac room, or, yeah.
Well, let's do that then. How much time would you want for the
The
tour?
jail takes about 45 minutes to an hour.
Perfect.
And then whatever the meeting, if we can do an hour of that, the tour and an hour of a meeting.
Yeah. Okay, that's a great invitation.
But, and I think we should every year do that, even stabilization center eventually to walk through.
Yeah, it's right across the park. Yeah, we could do,
See where we
meeting
are.
at Stabilization Center sometime too, and our newer members too, especially who have not been there. I think it's a really critical resource for this board to understand. Because the funding for that facility is always at risk, and
That's right, every year funding's a risk, so, and for the jail system, for police officers and for the community that lives at, it's such a great resource.
and just food for thought, not to make things super contained, is probably like. We have lots of locations and for behavioral health across the county. And so if there was ever an interest, we have meeting rooms at all of them. We could consider, with that way you could see the spaces which we work out of, and have a better understanding of where people get services here.
I love that idea. And if we tie
I
it
think
to
it's
a
a great
meeting,
idea.
instead of having it be a separate volunteer group going, let's do that. Do we have,
We have IT equipment at every space.
so we can do,
Yeah.
can accommodate people that are appearing on, online? Okay, awesome. So I think stay tuned on that, but I love that idea.
It's a little more logistics, but I
So,
think could be.
Stabilization, the jail, what else would you?
Yeah, I mean, we have our youth drop-in center that is also a really unique, innovative program that we offer with Deschutes County, both in Bend and Redmond. So that we had a meeting at our Wall Street Services building, which is also downtown. We have our Harriman Healthcare Clinic, which is our embedded Mosaic behavioral health clinic that's next to that building where Evan or actually Evan used to work, but so we could do one there. We've also got our Kingwood location, which is in Redmond. That's our newest building that also has a drop center. So, we have endless locations. So we'd probably want to pick a handful for the year. We got to think about travel and whether people are willing to. I don't want to organize something in Redmond if nobody can make it in Redmond,
Yeah, right.
one of those things. So we'd want to get a sense of whether people really wanted to drive and can drive. It's in lunch hour, people are working, it may not be feasible at every place, but I could provide a list of places that I think would be interesting.
Yeah, maybe we can talk about that or either you can send Lee and I an email, or we can talk about it on our next meeting. Are we gonna continue meeting with you?
Yes.
We'll find out.
Yeah, we're gonna get through the recruitment process and.
Here in one capacity or.
So this is Linda. I have a joke. It's meant to be a joke, but maybe not a joke. Maybe if you come to Redmond, we all have to find public transportation to get there.
We could be in trouble.
I know.
The sheriff's office has a bus that we can meet here and then go. It just adds time to the day.
Yeah, that's the problem. We all have our careers and we have to balance that a little bit too. So, okay, well, it is 1:30 exactly. So this meeting is adjourned. Thank you, guys.
Thanks, everybody. Really appreciate
Thanks for the
it.
great work, you guys.
Thank
and the
you.
planning.
Thank you. Good meeting.
And Amber did the biggest lift on.
Thanks, everyone.
I didn't want to bring it up, but Holly, did you hear anything about the collection programs?
I mean, no, I mean, other than, you know, deflection, reinvestment and impact. One application.